in case you missed any. Today, we'll be focusing our discussion on COVID-19 vaccine availability in Northern Michigan. Joining me today are the following local health experts. We'll have Dr. Nefsi, who is the Chief Medical Officer from Munson Healthcare. Heidi Britton will join us. She's the Chief Executive Officer of Northwest Michigan Health Services. Wendy Hirschenberger, who is the Health Officer for the Grand Traverse County Health Department. Dr. Jennifer Morse, who is the Medical Director of District Health Department number 10. Lisa Peacock, who's the Health Officer of the Leelanau District Health Department and Health Department of Northwest Michigan. And Natalie Kasaborski, who's the Deputy Health Officer for the Health Department of Northwest Michigan. So let's begin with an update on our current COVID-19 numbers, and I'd like to introduce Dr. Christine Nefsi.
Thank you, Diane. I am unable to start my video. There we go. Okay, just some minor tech problems there. So I'd like to start, as always, with our numbers. So you can see there our cumulative cases and the increase that we're seeing in our Northwest or our Northern Michigan region. One of the things that I do want to point out is that our cases per 100,000, which is on here, is going up over the last week. Last week we were at 347 cases per 100,000, and you can see here we're at 432. Additionally, last week we had a 7.4% positive rate on our tests, and we are at 9.1% today. So we are seeing a slight uptick in the number of cases we're seeing. Next slide. You can see here our number of inpatients across the Munson Healthcare system. So certainly a high number, especially compared to the spring, but a manageable one at this point. Next slide. That's just a graphic kind of showing you the same, so you can see where we had peaked earlier in the year or at the end of last year. We are seeing a trend down, but a very small uptick in the last 24 hours, and then that trend that we're seeing over the last 5 days in our percent positive and cases per 100,000. Next slide. So getting to the vaccine timeline. So you can see we have our phases here. And again, those phases were created not by Munson Healthcare, but by a larger group, the CDC, our Michigan Department of Health and Human Services, as well as ACIP, which is the Advisory Committee on Immunization Practices. We started with our phase 1A and continue in that phase 1A. That is our healthcare workers as well as our long-term care residents and staff. And we have just started moving into our phase 1B. Phase 1B is those community members that are 75 years of age or over, our frontline responders, school and child care staff, corrections officers, that staff, and then other essential frontline workers. You can see as well that the state extended the age group to 65 years and older. So as we start to delve into that phase 1B, that is also part of that group. Next slide. Again, as we have brought out this vaccine, it does take 2 doses to reach that 95% protection, and 10 to 14 days after that second dose. Herd immunity works when you have a large percentage of your population vaccinated, so it's important that we don't let our guard down. We continue to socially distance, wear masks, and do our hand hygiene.
Great, thanks, Dr. Nefsi. And now I'd like to share some more details about efforts at Munson Healthcare and who we've been able to vaccinate and our plans for next week, and then that will be followed by some statements from the local health departments with updates on their plans as well. So next slide, please. Starting with our own healthcare team members, as Dr. Nefsi just mentioned in that timeline, that was the 1A group where we were focused on for the last few weeks. In fact, someone pointed out to me today that it was, I think, 1 month ago today that the first vaccine was approved for emergency use authorization in the United States. So exactly 1 month ago, we began planning for this, and as of yesterday, we've been able to vaccinate 5,508 of our healthcare team members, and that represents 61% of eligible employees, credentialed providers, and contract workers we have working within Munson Healthcare facilities. And just to put some context to that, last week we reported that we had vaccinated 51.3% of our healthcare team. So as you can see, just within a week, we've made some great strides, and we will continue to focus on healthcare team members as well, because you know, they are a critical infrastructure to support this pandemic. Next slide, please. So I wanted to provide a little bit of context for the timeline and how Munson Healthcare has been approaching this, and sort of how much has changed just in 1 week. So last week we were here discussing on January 5th, you know, a lot of information and clinical information about the doses, and do you need a second dose, and kind of anticipating what some of the side effects would be. So up until that point, we were focused on our healthcare workers. Again, that was that Tier 1A group. But then all of a sudden, the next day after that last press conference, we were notified by the state of Michigan that we were approved to move to Tier 1B, and that could start as early as January 11th. So we quickly pivoted. We quickly took all of the learnings we had from vaccinating our own healthcare workers and quickly worked to stand up some clinics for our first patients to receive these doses. Next slide, please. So as you can see in this orange, oh, sorry, one, could you go back 2, please? Sorry. Thank you. So as you can see in the orange, from January 7th through January 9th, that was over the weekend, we quickly got teams together, figured out facilities, figured out locations, how do we get the IT infrastructure at those locations, because there are requirements that we have to enter certain information into databases as we're vaccinating, making sure we had the proper storage for the vaccination. All those logistics and details had to quickly be identified within a very short amount of time. But our teams sort of rose to the occasion, and on Sunday, next slide please, on Sunday, January 10th, we were actually beginning to notify for the first group of Munson Healthcare patients that we had identified for being eligible for the vaccination. So we had teams of people over the weekend emailing and calling those specific patients, and I'll get to more details on who those patients were in a minute. And then yesterday we began scheduling those patients, and I'm excited to report that today we are actually in the middle of administering the first doses for Munson Healthcare patients age 90 years and older in one clinic today. And we expect today that we are going to be able to vaccinate just over 300 patients. Next slide, please. And next in this orange section, I just want to give you a sense of what else will be happening this week. We do plan to add 5 more clinics across northern Michigan to those patient vaccine clinics. So those will be opening soon, and patients are starting to be notified. Our goal this week is to vaccinate 2,000 patients, and then next week another 2,000 patients. And again, there are some limitations on how many people we can actually get to in a certain amount of time, and I'll get to some of those limiting factors in a minute. But I just wanted to give you a sense of the timeline and how quickly things are changing, and how quickly Munson Healthcare is trying to pivot and make this vaccine available to as many people as possible, and closely collaborating with our local health departments on a daily basis on the coordination of this. So next slide, please. So just to give you a sense of the population that we are now faced with vaccinating, which we're really excited about because there's a lot of demand for it in northern Michigan. When we look at the population that's age 65 and older, in the state of Michigan, there are about 1.8 million residents who are 65 and older. Within the Munson Healthcare service area in northern Michigan, that equates to about 132,000 people. And if you think about it, the number of people that we are now responsible for vaccinating along with the health departments has really increased tenfold in 1 week. So there are a lot of logistical considerations that we're working through and we're actively preparing for. You know, some of those are related to supply. There's still an uncertain amount of supply as we get allocated supply from the state. And maybe Dr. Nefsi, you could comment on that, on how the allocation works and sort of, you know, how we anticipate staffing these clinics and trying to anticipate how many people will be able to vaccinate in a given time.
Yeah, that's a great question, Diane. The way that it works is we make a request, as does every other health department and healthcare organization across the state, about how much vaccine we want. And then actually the federal government allocates however much vaccine they have to each state, and then the state allocates it back out. So, you know, as an example, we got less than 1,000 doses this week of vaccine, and we've been told we're not receiving new Moderna vaccine until the end of the month. So, you know, what we request and what we want to give out isn't always the same as what we receive. We are hearing that with some of the issues at the federal level, that is disrupting somewhat the vaccine allocation. And so, you know, we continue to work with the state and meet with them regularly, as do our health departments, to try to understand how much vaccine we're getting. And then we adjust our clinics for what we think we will receive. And that's, you know, the reality that we're trying to figure out right now. That's just one of the logistical issues we try to work out.
And Dr. Nefsi, can you comment on, I know we've received some questions on why healthcare workers were prioritized over maybe, you know, and I should mention that was also long-term care workers and residents in that Tier 1A category as well. But why were they prioritized, and is that work stopping now? Is that going to continue? How are these tiers going to overlap?
Yeah, it's a good question. So I'll answer the first part, and that is, I think I mentioned earlier that those tiers were really brought about through collaboration with ACIP, the CDC, and health departments. And so you will see a bit of difference from state to state based on what their state health departments have done in their interpretation of what the CDC and ACIP did recommend, but they are generally going to be pretty close. That being said, as I mentioned earlier, we're doing this concurrently. So we're not waiting for one tier to be done before we move on to the next one for efficiency's sake. So that's where those recommendations came from. The long-term care facility residents and staff really were prioritized because they bore such a brunt of morbidity and mortality early on in this pandemic. They were seen as a very high-risk group, so that is why they were prioritized. Healthcare workers were put ahead, I think, of our elderly because they don't have a choice of coming into work. We are essential workers. Our frontline employees especially, and as most healthcare providers, have to come to work. They have to take care of ill patients, and so they are at a bit of a higher risk. I think the thought was that our older populations could still cocoon and protect themselves somewhat, and so the decision was made to put healthcare workers first and then open it up to our higher risk older patients.
And Dr. Nessie, have we been able to work with other, because we talk a lot about Munson Healthcare and our own employees, have we also been helping to vaccinate any other healthcare workers in our communities?
Yeah, absolutely. As soon as we saw that we had open vaccine spots that weren't being taken by our own employees, we opened that up to other healthcare workers in our communities across northern Michigan.
Great. Okay, next slide, please. There's a little bit more information I want to share on how Munson Healthcare is prioritizing this, and Dr. Nefsi, you can help me explain this as well. When we looked, as I just mentioned, it's a very large portion of our patient population. When we look at current patients that are established with a primary care provider that is a Munson Healthcare primary care provider, so there are other providers in our communities that are not affiliated with or not employed by Munson Healthcare, so we can access our own databases and look at who our own patients are. That's about 48,000 patients in these practices and clinics listed on this slide here. So what we did was we knew we didn't have enough vaccine to vaccinate everyone, all that entire 48,000 group, or everyone 65 and older within that group at once. So we decided to prioritize those who were 90 years and older, and that's who we began reaching out to on Sunday, and that's who we are currently scheduling. So again, we just wanted to provide some visibility and transparency. So there was a lot of confusion we heard about, I'm not sure if I have a Munson Healthcare provider, or if I'm part of another practice and I have a doctor somewhere else. These are the clinics and the practices that we've begun working with. And again, we can only expand based on the number of doses we have available to us right now. And we do plan to expand to some of our specialty practices later this week or next week to try to get in some of those higher risk populations as well. So Dr. Nefsi, can you add any additional commentary to that and who those other people with risk factors might be?
Yeah, I think you summed it up beautifully. As we understand further how many people in this age group, and as we move that down to 86 and then 80 and all of that, and fill up those clinics, we'll continue to do that. We also are looking to expand to our specialty practices, so that will bring in a lot more of our higher risk patients. So when we say specialty practices, we mean like cardiology or oncology, nephrology. So some of those patients will also be included. They may have primary care providers outside of Munson Healthcare, but they would be included as a patient of our subspecialty clinic. So we are looking to expand the access to the vaccine to these higher risk patients as much as we can, given our clinic capacity and our dosage of vaccine, or allocation rather of vaccine.
And I just want to also point out that, please don't call these clinics trying to think you can get on a list. We already know who the patients are that meet certain criteria, and it's been really efficient and effective as we work through the allocation, that we identify a certain group of people, and then we begin to email and make phone calls to those individuals and actually get them scheduled into a clinic. So, technically, if you're a patient, if you see a doctor at one of these practices, you're already on a list. So we know who you are, and please be patient with us because these practices and these clinics are not the ones actually giving the vaccinations out. The vaccinations will be held at an independent location affiliated with one of the local hospitals, but don't expect to go to your primary care physician today and expect to get vaccinated at that clinic. This is just meant to be a summary just to try to help people understand what is a Munson Healthcare provider and clinic versus what is an independent one. So more information will be shared as we learn it, and more outreach to those patients and expansion will continue as we get more vaccine doses available. Next slide, please. So I just want to reiterate this slide that Dr. Nefsi mentioned, which is, when I first took a look at this, I was a little confused by it because I kept hearing 65 years and older. And really, I just want to point out that, two things. It's that 65 and older group, which is still technically in 1C, has been accelerated in the timeline. So now they're kind of considered, we're doing that at the same time as 1B. So I just wanted to make that point. And then really reiterate how much we need your help in just being patient as we work through this with our health departments, because this is the state's timeline for vaccine availability. And as you can see, it will be to the end of December before we get to everyone in the state of Michigan. And Dr. Nefsi, I don't know if there's anything else insight you can provide on that, because I know you're on calls with the state regularly, correct?
Yes, and I would say, the state really, we've talked about this before, but the way that we're going to get through this is not with the number of vaccines we have, but the number of vaccinations we're able to do. So, really the goal broadly is to get as much vaccine into arms as quickly as we can. And that is going to be fluid. We've already seen, we got our first allocation of vaccine on the 17th. It's changed significantly even since then. And so this is a very fluid thing. We are trying to coordinate with everybody that is going to be receiving vaccine. And that's even different. Like, none of our clinics have received vaccine yet. Our health departments have, and our hospitals have. And so we're just really trying to work together as best we can to ultimately get all of the people that fall into these categories immunized as quickly as possible. But, it's a huge undertaking. And, we still aren't entirely sure, and neither is the state, about how much vaccine we'll be getting. And so we just continue to say, try to give as much guidance as we can about who's next on the list and how we'll get to them, and then, hit the ground running and trying to get it into those folks' arms.
Great, thank you, Dr. Nefsi. And Dr. Nefsi, we'll come back to you during the Q&A session to address some of the questions we're currently receiving. But now it's my pleasure to introduce Heidi Britton, who is the CEO of Northwest Michigan Health Services. Heidi, you have a really good perspective on the broader distribution plan in Northern Michigan, because you work with all the local health departments. So can you help us explain what you're seeing and why things may be looking different from county to county as you're working with the health departments?
Okay, thank you for having me today. You can advance my slide and we'll talk kind of through it through here. And Dr. Nefsi already has hit a lot of really high points here that we'll want to reiterate and support in what our messaging today. So all of us are receiving vaccine allocations separately and at different times. So the hospitals and the health departments. The FQHCs or primary care offices have not begun being able to even order the vaccine. So it's really limited right now in the state of Michigan to just hospitals and health departments, which is fantastic because, as you can see, there's several obviously thousands of doses being requested. The state was only able to fill 60,000 this past week. And so it's nice because you only have two major entities asking for the vaccines. You don't have it complicated by having multiple other agencies, clinics, asking for the vaccine as well. So we're really relying on the primary care offices, the federally qualified health centers, relying on our hospitals and our health departments to streamline this and get this done as quickly as possible, as guidance has been given. Of course, the counts and requests are based on the number of people that you anticipate. So as an FQHC, we have about 1,065 years and older patients. So we would request about 1,000 vaccines, and then we're required to get those vaccines in arms in a reasonable amount of time. And there's guidelines that the state has given us to do that as well. But the allocations continue to remain uncertain, and I think that's really important to say. Since we're so early on in giving out the vaccine, there's so many questions. We're all receiving them from our friends and our family and our patients. But I just would encourage that our collective goal is to make sure that this is equitable and fair distribution of this. And although it's not centralized, it is centralized in each county, which is powerful. I think the health departments are doing a knockout job, but each of them also have to ask for their own allocations, and they can definitely speak to that better than I can. But I know as far as an FQHC, I think watching how they're distributing it and how seamless it is for again, friends and family that I know have gone through the process to get the vaccine is remarkable, especially after only being a month since it's been approved. Next slide, please. So, again, NMHSI, Federally Qualified Health Center, we serve our counties from Traverse City, Benzie, Leelanau, Manistee, all the way down to Shelby. At this time, we are not able to order our vaccines. We anticipate in about another 2 weeks or so. So towards the end of the month, we'll be another player to be able to order our own vaccines. However, at this time, we're partnering with the local health departments since they can get the vaccines. And again, as Dr. Nefsi said, let's get the vaccine in people's arms. We're going to support them in getting that work done, and working through these priority groups is the best way that we can do it. Obviously, we have done the COVID testing since April of 2020, and so we have our pods outside. We have our testers that sit outside. They'll be transitioning into vaccinators. We have our mobile clinic that we use to vaccinate our own staff, and so we're ready to serve the community at large. With the different priority groups in concert with the local health department, which we're really excited about. The local health departments are really the tip of the spear for this work. And I would just continue to encourage our residents to go to the local health departments to sign up. And that message just needs to continue to be spread, especially when the state opened up to the 65 and older. They've been waiting. And so getting that information out has been really valuable, I think. And I'm really hopeful that this is just gonna keep on getting vaccines. As long as we're busy getting vaccines in arm, I think that's a success for us. And I think that is all for me. Diane?
Thanks, Heidi. That was a great overview, and I think it summed it up really well about just sort of the differences that we may be seeing across Northern Michigan. But I agree that because there is so much demand, I think that's just a really good and exciting thing throughout the course of this pandemic. So thank you, and we'll bring you back for a Q&A session in a minute as well. But now I would like to introduce Wendy Hirschenberger, who is the health officer for Grand Traverse County Health Department, to provide an update on what's happening in Grand Traverse County. Wendy?
Hi, good morning. And I do want to share with everybody, I do not have video. Just so you'll see my picture, and I'm sorry about that. And I'm glad Heidi brought up testing, because I did want to point out for all the local health departments that we are still doing testing. As Dr. Nefsi mentioned, we're back at numbers and rates that we were seeing earlier in December. So those are kind of the highest numbers we've seen throughout the pandemic. We're not at the absolute highest, but we are quite high. And so the testing work continues, as does the contact tracing and case investigations and some of the enforcement activities. So that's outside of the efforts for vaccines. So just so people get a little bit overall understanding of the breadth of the workload with local health departments right now. So for local health departments, we're following the Michigan Priority Vaccination Planning, as was discussed, with the overall goal to vaccinate 70% of the population as safely, efficiently, and effectively as possible. And that's times 2, because with all the vaccines, there's 2 doses. So we don't want people to forget that, once you get a first dose, you have to get a second dose within a certain time period as well. In Grand Traverse County, we are actively vaccinating phase 1 healthcare workers. We are preparing for 1B. We have a lot of healthcare workers in our county outside of the hospital. We have over 3,500. So we are working our way through and expect to be done with that group by the end of next week. And it's also important to note that the counties are going to vary by the number that fall into each of these sub-priority groups, just based on the makeup of their businesses, their industry, the ages, and things like that. So there will be variation. Our goal this week is to vaccinate 700. And then moving forward, starting next week into the foreseeable future, we will expand to more mass size clinics of 2,000 to 3,500 a week after that for the foreseeable future. And of course, all of this is based on vaccine availability. That's really the underlying kind of driver for how big our clinics can get, along with staffing. And our mass clinics will be a mixture of first and second doses, because we have to weave in the second doses into our planning process as well. And we will also be including the Michigan National Guard as part of our vaccinators, and eventually we'll be weaving in volunteers as well. So we hope to be to that, end goal number of 3,500 by the end of next week. So what's important to know for Grand Traverse County is if you are in that 1A category, that you are a healthcare worker and you haven't been vaccinated through the Munson system or one of our clinics already, we do have on our website a request for an appointment. And so we do ask that you go out there. If you go to Grand Traverse GTCHD.org and then go to the COVID-19 vaccine information page, that link is right at the top of that page. Also of note that the 1B, those who qualify for the 1B, which are some of the essential workers and frontline workers that have the frequent or ongoing exposure as part of their work. So first responders, police officers, jail and prison staff, pre-K through 12 teachers, childcare providers, and a few others. That link is out there as well. So that begins to give us a better idea of planning for our larger clinics. And there also is a link out there as well for the 65 and over group. So there's 3 different links. And we do ask if you're eligible now, you can fill out an appointment request. We will contact you when those appointments are available. We will have a scheduling tool. That's how ours is working. And so it could be weeks and it could be longer, depending on how big these groups are and how fast the vaccine comes in. So we do ask that people be cognizant, aware of that, and have some patience. And they will be by scheduled appointment only. We will not be having long lines or first come, first serve. So, we'll be respecting social distancing and scheduling because of our vaccine availability. So there will not be walk-ins either. We will push the information out through as many media avenues as we have, including our website. So we do encourage people to frequently be looking there, and are asking that people reserve our phone and our email capacity for those who can't easily access the online information. So know that if you submit that information, we have it, and it's just a matter of waiting. We appreciate that everybody is enthusiastic. It's really important for us to hit that 70% of the population goal, and that we are working very hard to, get through this as quick as we can, but it is going to be, another 10, 11 months of this. So, and also just to know that we can't individually answer every single person's question about timing or priority groups. We're doing the best we can, as I'm sure most health departments are, but we are getting a lot of direct emails, questions, comments on our Facebook pages, things like that. We, I think, have listed information, how you can contact us, and we do encourage the 65 and older group who might not have internet access or be able to sign up online to call this hotline that was set up through the Area Agency on Aging in partnership with the United Way and 211, and they actually will help navigate any senior through that process to the correct county and that process. I think that's what I have to share today.
Great, thanks, Wendy. I think that's a great overview. I think that gives a really good sense of what people in Grand Traverse County should do. So again, what I heard was, please use the website and fill out the form if you can. If you're 65 and older or don't have access to the internet, then you can use the phone line. But again, I think, we're seeing the same thing from Munson Healthcare. A lot of our switchboards and clinics are getting inundated with phone calls and questions, and we are having the same problem of it's just becoming getting to a point where we can't answer everyone's individual questions, and that's why we're doing these press conferences, and that's why if you do have access to the website or social media, that's where the latest information will be posted. So thanks, Wendy, I appreciate it. Next slide, please. Now I'd like to welcome Lisa Peacock back. She's with the Benzie Leelanau District Health Department and Health Department of Northwest Michigan. So Lisa, what's happening in your districts?
Hello, thanks so much for having me. And I will try to just enhance some of the information that's already been given. So many great points have already been made. So I'm Lisa Peacock. I'm the health officer for the Health Department of Northwest Michigan and the Benzie Leelanau District Health Department. And I would echo Wendy's enthusiasm that we are just really excited about how excited people are to get the vaccine. We work so much with vaccine hesitancy that is just really refreshing. And we want everyone to know that we will eventually get to all of you. It just can't all happen at once. And so we do need people to be patient and to utilize the resources that we're trying to make as available as possible. And just remember that all of those resources are receiving a lot of traffic right now. And so if you don't get through on the website, or you have trouble, or you can't get through on the hotline right away, please just try again in a few hours or in a couple of days, and we will help you. You will get there. As an administrator of 2 local health departments that cover 6 counties, I look at this from a regional approach, just like I look at everything from a regional approach. And I think that one of our goals within our distribution plan at my health departments is really to increase the number of access points that we have across the region. And so whether that means working in innovative partnership with our hospitals and our FQHCs and other healthcare providers and other local health departments to redistribute vaccine, that's part of it. And so is creating our own vaccination clinics that are distributed across our jurisdictions. So we are using a strategy of small, medium, and large clinics that are available in all of our counties every week at different times, so that we can hopefully just create lots of opportunity for people in all of the priority groups to get vaccinated as we have vaccine available. That's another really important point. We have to schedule week by week, because we only know what allocation we're getting at the end of the week for the following week. So please be ready for quick turnaround when we call you or reach out to you via email to schedule your appointment time. It may be in just a couple days, it may be the next day. But that is the process that we have to work with right now because of the just the pattern of vaccine allocation and the availability of vaccines and how they come into the state. And then I think just again, I will echo what others have said, and just we can't let our guard down now. We certainly are seeing upticks across our region. Our cases certainly have been rising over the last 3 weeks as well. And so it's not the time to stop getting tested if you have symptoms or you have had an exposure or have any concerns at all. Certainly there is widespread testing availability across the region now, something that we really worked hard to put in place. And we need to continue to identify people who are positive for COVID and get their contacts quarantined and positive individuals isolated. So continue to wear your mask, continue to be in compliance with the gathering limits and the different safety precautions that are in place, because we really do need to keep everyone safe even as we are moving forward with our vaccination efforts. So I'll stop there, and happy to answer any questions when it's time.
Great, thank you, Lisa. And our final panelist for the day is Dr. Jennifer Morse, who's the Medical Director of District Health Department number 10. Welcome, Dr. Morse. We'd love to hear your update.
Sorry. All right. Sorry about that. Well, I just echo what the other 2 speakers from my fellow health departments have said. It's just to ask everyone for their patience. We are working as quickly as humanly possible with this, and really are limited by the amount of vaccine that we have. We are all getting emails and calls, asking for vaccination. And we just encourage people to utilize our website. We're posting to social media as well, putting out press releases, and most health departments also have email alerts or email newsletters people can sign up. we appreciate that for those who don't have access to internet, that can be a challenge. And so we ask that they perhaps ask friends, family, neighbors to help keep them alerted. But to understand that, we're really busy at this point trying to get vaccine clinics going. And so to just bear with us. But we are vaccinating as quickly as possible in District 10. On Friday, we vaccinated approximately 1,400 individuals. Yesterday, we hit just under 1,500 individuals in our 10 counties. We are right around 250 vaccines in each of our 10 counties. So we are doing, we did not vaccinate in all 10 counties yesterday, but those that we did vaccinate in, we were right around 250 doses. And so I do notice that, there is a delay in the numbers on the state vaccine database. And so just keep that in mind if you are tracking those things, that those numbers are not always real time. So I'm quite proud of our health department for the work that they're doing. We have vaccine clinics every day in all 10 counties. Some counties may not have them every single day. We also have vaccine clinics on Saturdays in most counties, but they are appointment only. I think one of the biggest challenges with this vaccine is the need to keep people distanced and safe because of the risk of COVID. And so that's very different from your typical flu vaccine clinic where you don't have to worry about that. Plus, we're very concerned and cognizant of the risk for allergic reactions since it's a brand new vaccine. So our staff and our nurses are very, very aware of the need to have people where they can safely monitor them after vaccination. So for all those reasons, we really have to have appointment only so that we know who's coming, we know how to space them and know we have enough room. Plus, as has been mentioned many times, we have limited amount of vaccines. So we have to make sure that we have enough vaccine for the people that are coming in. So right now, we've already allocated out all the vaccine that we have. In fact, we have had to cancel some appointments because we did not get all that we were hoping for. If you go to dhed10.org, actually, if you go to dhed10.org/COVID-19-vaccine, that has our most up-to-date information. And once we have more vaccine available, a new link will be placed there to schedule appointments. Really, again, like I mentioned, keeping up to date on our alerts is pretty easy at District 10. If you go to dhed10.org/subscribe, our information officer regularly puts out some very nice updates, and it will include new clinics, but also other information about COVID. So again, we are working as quickly as possible. We do have a big lift. We have just under 50,000 individuals over the age of 65 in our 10 counties. So, so we're excited to get this done. We're excited to be doing something proactive, but it will take time. So that is all. Thank you.
Great. Thank you, Dr. Morse. I'd like to bring all of our panelists back for a very quick Q&A session. We had a lot of information to convey today, so our Q&A session will be a little bit shorter because we do have only a couple minutes left here. But to get quickly to some of the questions, Dr. Nefsi, there's a question about vaccine being available through Kalkaska Memorial Health Center, and I just want to clarify that Kalkaska Memorial Health Center is affiliated with Munson Healthcare, but they are not owned by Munson Healthcare. But I do believe they're standing up a clinic this week as well, right?
My understanding as well, yes.
Okay, so I think the best thing to do is to go to the website, and we can make sure. I will work with the Kalkaska team to make sure that we have that available on the website. Can someone from one of the local health departments, and maybe I'll start with Wendy, can you address how are the schools going to be getting vaccines?
Yes, the schools are school staff. So anyone who deals with the children are part of that 1B group. So I think most health departments have weekly conferences with their superintendents, and so we are working directly with the schools on their process for getting vaccinated.
Okay, great. I'll send this one over to Lisa. Do you, and any of the health departments, do you expect any challenges in getting people their second doses through the health departments?
So far, that's gone pretty well. We have been following a pattern of scheduling their second appointment, at least I can speak for my health departments, scheduling their second appointment when they schedule their first appointment, so that we do both of those appointments at the same time. We definitely plan our clinics that way. We have first dose clinics and second dose clinics, and just to make sure that we can keep it all organized. So I don't anticipate that there will be a problem. I don't know if enthusiasm will wane over time, but right now people who are getting vaccinated really want both doses and are coming back for them.
Great, thank you. And on a related question, Dr. Nefsi, you mentioned how the allocations are working. Is there any concern in distributing more of the available, that distributing more of the available vaccine will cause a shortage of second doses available, and how is this being handled or prepared for?
Yeah, it's a great question, and I'll just follow exactly what Lisa said. When we schedule folks, we are scheduling them both for the first and the second dose, and then we are managing our vaccine supply in that way so that we can be sure to have enough vaccine to give the second dose.
And Dr. Nefsi, are we seeing any, now that we've begun giving some second doses through Munson Healthcare, are we seeing any different side effects? And do we anticipate that this age group of 65 and older, or even 90 and older, are going to have different side effects?
So two separate questions. I'll start with the first one. Yes, actually, as we have started our second dose clinics for employees, we have noticed a slight uptick in the reporting of some side effects. Mostly, they are kind of what we expected, a sore arm, just generally not feeling very well for a day. And then some people are reporting even some swollen lymph nodes on the side, in that armpit of the side that they are getting that vaccine. So we are seeing a slight increase in the number of side effects, although I wouldn't say any increase in severe side effects. So we kind of expected this. And again, those are all signs of your immune system kind of kicking in and doing what it's supposed to do. One of the concerns with our older population is they tend not to have as robust an immune response. So in that light, we would actually expect that they would have fewer side effects. But you know, again, as we start these vaccinations across the country, it's certainly something that we will monitor.
And Dr. Nefsi, this is going to be our final question because we are out of time today, and I apologize. Again, we had to get through a lot of information today, but we will be looking at all the questions coming in and updating our FAQs. But can you please just clarify one more time? Some community members think that everyone will be vaccinated by the end of March, because I think the initial news stories said general availability by spring. Can you provide a more realistic timeline?
I mean, I think the slide that we showed earlier on in this presentation might be more realistic. I mean, honestly, I think that our health departments and our healthcare organizations are ready to adapt to the supply of vaccine. A lot of how quickly we'll be able to get vaccine out depends on how much vaccine we get. So it's really hard to make a prediction with any kind of accuracy without knowing that. All I can say is as soon as we get it, we'll put it into arms as best we can. But I would say March is probably a little bit too optimistic even for me.
Okay, thank you. Can we bring up some of the final slides? We have some summary slides that list all of the different contact information and resources available, because honestly, the majority of the other questions we're receiving, if they're not specific to an individual condition, it is related to where do I go, how do I get information? There was a lot of information shared today, so if you could bring up that last couple PowerPoints here. Just some community resources. These will be available on Munson Healthcare's website as well. We're actually pointing to a lot of other resources with the local health departments in the state of Michigan and the CDC, but there is that 211 Michigan. There's either the phone number or the website you can go to there. We mentioned the area Agency on Aging of Northwest Michigan has some really great resources, both by phone and email. And the next slide, please. I think there's one more. Oh, maybe not. Oh, here we go. I thought we had a slide with all the health departments. So we'll start with, even though they're not a health department, Northwest Michigan Health Services. Heidi mentioned that they do not have any vaccine yet, but more information will be available on their website when they do. Wendy mentioned the Grand Traverse County Health Department. The best resource is the website. Fill out the survey, fill out the form to get on the list, and then they will call you back, although that will take some time. And if you are 65 or older or do not have access to the internet, those are the folks that should be using the phone number. And then Lisa mentioned that in Northwest Michigan and Benzie Leelanau districts, really the phone lines are not the best option there. Really going to their website and looking for information on when new schedules will become available is the way to work it in those districts. And then District Health Department number 10, there's the email or the website, and there is a sign up for public health alerts as well. You know, I know that this is it's a lot of information, and it's slightly different in each district or with Munson, even within Munson Healthcare. But again, our collective goal, we meet. I don't know, Dr. Nefsi, I think you meet daily with representatives from the health departments. We are collaborating again to get as many vaccines in arms as quickly and efficiently as possible. And just, you know, the other thought is this is going to take a long time. It's going to take probably till December to get everyone in the state of Michigan, and tiers are going to start overlapping. We will continue our work to get healthcare workers vaccinated and then begin vaccinating those other populations we mentioned in Tier 1B. So thank you again to all of our panelists today. We will have this representative group back in 2 weeks to give another update. Next week's press conference from Munson Healthcare will probably be more clinical focused. Again, we can give some updates on the vaccine rollout, but we won't have representatives from the health departments back for another 2 weeks. So again, we do archive these on our website if you missed any of it. And we thank you for your patience, and we're excited to be part of such a historic moment in Northern Michigan and in our country. So thank you, everyone, and have a great day.